Welcome to the Deep Dive, your shortcut to being truly well-informed. Today, we're diving into a topic that is absolutely critical for anyone who loves or cares for horses: equine tetanus. We've got a robust stack of sources here, and we're going to unpack everything you need to know about this, well, formidable disease. From its surprising origins to its devastating impact, how veterinarians fight it, and maybe most importantly, how to prevent it. We're talking about a condition that horses seem uniquely susceptible to, and it has an alarmingly high mortality rate, sometimes, exceeding 50%.
Yeah, it's a disease that really highlights the importance of proactive care in the equine world, definitely. Our mission in this deep dive is to distill the complex science behind it, understand how it's diagnosed, explore the multifaceted treatment strategies, and crucially, emphasize the paramount role of prevention. By the end, you'll grasp not just what tetanus is, but why it behaves the way it does and, well, what that means for our equine companions.
Okay, let's unpack this then. Tetanus in horses. It's a severe and often fatal neurological disease. Here's a surprising fact right off the bat. It's not contagious. You can't catch it directly from another affected animal. So if it's not spreading horse to horse, what is it? Where does it even come from?
Right. A key point here is the culprit. It's a bacterium called Clostridium tetani. Now, this bacterium is what we call an obligate anaerobe.
Anaerobe, meaning no oxygen.
Exactly. It thrives only in environments completely devoid of oxygen, and it's found pretty much globally. It forms these incredibly hardy spores, spores that can persist in soil for many, many years. These spores are also commonly present in the digestive tracts and feces of horses and, well, other animals too. So they're constantly contaminating the environment.
Wow, okay, so these spores are basically everywhere, but how does this bacterium, which needs this oxygen-free environment, actually get into a horse? We often hear about rusty nails, but is that the whole story? Is it always something dramatic like that?
That's a really important question about entry points. See, these spores, they germinate and multiply whenever they're introduced into an anaerobic environment. So any low oxygen space created by a wound.
Any wound?
Pretty much. It could be a deep puncture wound, sure, like the rusty nail example, but also a laceration or even just a minor cut that quickly seals over, trapping things inside. It's crucial to understand that any break in the skin, no matter how tiny, no matter how well healed it might look on the surface, carries a potential risk.
Okay.
And horses' lower limbs are particularly susceptible.
Why is that?
Just inherently poorer oxygenation compared to, say, more muscular areas, less blood flow sometimes. And common entry points aren't just punctures. Think about hoof abscesses.
Ah, right.
Castration sites, retained fetal membranes in mares after foaling, even umbilical infections in newborn foals.
So it's much broader than just stepping on something sharp.
Absolutely.
Yeah.
The focus really needs to be on general wound hygiene. And horses, they are just exquisitely sensitive to the neurotoxins produced by Clostridium tetani, which makes them among the most vulnerable mammals to the disease, unfortunately.
It really sounds like a constant environmental challenge then. Now, once these bacteria do get into a wound and start growing, they release toxins. Our sources mention two main ones, tenelysin and tenospasmin. What do these toxins actually do inside the horse's body?
Okay, so tenelysin is a type of toxin that breaks down red blood cells and causes local tissue damage. This crucially helps create those low oxygen conditions that Clostridium tetani needs to multiply.
So it helps itself.
Kind of, yeah. It makes the environment better for producing its primary neurotoxin, which is tetanospasmin. And tetanospasmin, that's the real villain. That's what causes the disease's severe clinical signs.
Okay, the villain. How does it work?
So to connect this to the bigger picture, once tetanospasmin is released, it enters nerve terminals, local nerve endings, and then it undergoes what's called retrograde axonal transport.
Retrograde.
Yeah.
Like backwards.
Exactly. Think of it literally traveling backward along the nerve pathways, like a message going up a telephone line, all the way to the central nervous system. So the spinal cord and the brainstem.
And once it gets there, into the central nervous system, what's the impact? What does it do?
There, it permanently binds to the off switches for muscle activity. These are the inhibitory neurons, the ones that normally tell muscles to relax or calm down.
Okay.
Tetanospasmin acts like a molecular scissor. It actually cleaves a protein that's essential for releasing those inhibitory neurotransmitters, like GABA and glycine.
So it breaks the brakes.
That's a great analogy. Imagine a car where the accelerator is stuck down, and the brakes just don't work. The result is uncontrolled motor neuron activity,
Leading to?
generalized muscular rigidity, unopposed muscle contraction, basically muscles firing constantly. and incredibly painful, severe spasms. You often see initial symptoms appearing in muscles served by shorter nerves, which is why the face and jaw are often affected early.
Okay. That makes sense.
And what's also critically important is its impact on the autonomic nervous system.
That's the involuntary stuff, right? Heart rate, breathing.
Precisely. Heart rate, breathing, digestion, all that. This can lead to the horse's involuntary nervous system going into overdrive, sympathetic hyperactivity, manifesting as things like excessive sweating, a dangerously fast heart rate,
Yeah.
tachycardia, and sometimes, weirdly, unpredictable swings in blood pressure, both high and low. Gastrointestinal impaction, diarrhea, bladder dysfunction can also occur. It messes with a lot of systems.
Wow.
And the binding of this toxin, it's permanent. Permanent, which means recovery depends entirely on the slow, arduous process of the body literally growing new nerve connections, new axon terminals sprouting, which can take weeks, many months.
Yeah, that's a sobering thought, that the damage is done and it's just waiting for the body to maybe rebuild. And you mentioned that the onset of symptoms can be delayed, sometimes weeks after the initial wound.
Exactly. And that delay makes early detection incredibly challenging.
So how long is that incubation period typically? And what are those initial signs, the subtle ones maybe?
It's highly variable. It can range from just a day, maybe 2, up to over 40 days.
40 days, wow.
Yeah, but a typical average is maybe 10 to 14 days. And those initial signs can be very subtle. Maybe just some localized stiffness in a limb, the difficulty swallowing, dysphagia we call it, or just an exaggerated response to sudden noises or touch, that hyperreactivity.
Right, easily startled.
Very easily startled, yeah.
And then as it progresses, it takes on those, classic characteristics we might have seen in pictures or descriptions. Very distinct.
Exactly. As the disease progresses, that generalized stiffness intensifies. It leads to really characteristic postures. You'll see the horse develop a rigid sawhorse stance.
Describe that.
They stand with their neck, back, and limbs rigidly extended, often with their legs stiffly sort of spread apart, abducted, almost like they're bracing themselves constantly. There's also the sardonic grin, that fixed facial expression from muscle spasms around the mouth.
Unsettling.
Very. And often a stiff, elevated tail, erect ears, dilated nostrils, just total tension. And a key diagnostic sign, very unique to tetanus, is an exaggerated protrusion of the third eyelid.
The third eyelid?
Yeah, that little membrane in the corner of the eye. It flicks across noticeably, especially when the horse is lightly stimulated, like by clapping near their head.
Huh, okay.
In severe cases, these muscle spasms can be so powerful they actually cause bone fractures.
Oh my gosh.
Yeah, and ultimately, it can progress to severe difficulty breathing, the inability to stand up at all, recumbency, seizures, and then eventually respiratory failure and death.
Just awful. Are there different presentations of tetanus besides this generalized form?
Yes, while generalized tetanus is the most common, we do also see neonatal tetanus in foals.
Newborns.
Yeah, this usually happens when foals haven't received enough protective antibodies from their mothers through colostrum, typically because the dam, the mother, wasn't properly vaccinated before foaling. And infection often enters through the umbilical cord stump, a common entry point there. These foals progress really rapidly to the classic signs. They often become recumbent, unable to stand, have seizures, though, interestingly, their survival rates can sometimes be comparable to adults if they get really aggressive management early on.
Okay. So with all these signs, diagnosis, is it straightforward or tricky?
It's primarily clinical. Based on observing these classic signs, often combined with, an unknown or negative vaccination status and maybe a history of a recent wound, even if it's healed. But it's frequently a diagnosis of exclusion.
Meaning you rule other things out first.
Exactly, because those early subtle signs can mimic many other conditions, things like laminitis, rhabdomyolysis, that's severe muscle damage, tying up. Even rabies can look similar initially. It's particularly important to distinguish it from botulism, for instance.
How's that different?
Botulism causes flaccid paralysis, limpness, weakness. It's essentially the opposite of tetanus's spastic rigidity.
Got it. Opposite signals. That sounds incredibly challenging for veterinarians then. Are there lab tests? Can you run a blood test or something to confirm it?
Well, lab confirmation can be quite challenging, often yields false negatives.
Why is that?
Because you might not be able to isolate the bacteria from the wound site anymore, or the toxin levels might be low in the blood, and you can even get false positives just because Clostridium tetani is so ubiquitous, so common in the environment. It might be present, but not actually causing the disease.
So a positive test helps, but a negative one doesn't rule it out.
Precisely. And what's also crucial to remember is that corticosteroids,
Steroids, like dexamethasone.
yeah, common anti-inflammatories used in horses for lots of things, they can actually mask or significantly delay the typical clinical presentation of tetanus, which makes early diagnosis even harder if the horse has recently been treated with them.
So you need a really good history.
A meticulous history of recent medication use is absolutely vital, and monitoring the progression, especially the increasing severity of those autonomic disturbances we talked about, the fast heart rate, the gut issues, that serves as a critical real-time indicator of the toxin's systemic impact.
Right. Okay, so let's say the diagnosis is made or strongly suspected. What's the game plan? Our sources make it pretty clear that recovery is a long, arduous process, if it happens at all.
Indeed, it is. The management of equine tetanus it's comprehensive, and it has to be immediate, since the toxin's binding to the neurons is irreversible, as we discussed.
The damage is done there.
Right. Treatment is primarily aimed at supporting the horse, just keeping them alive and stable until their body can literally grow new nerve connections. And that means providing intensive care for weeks, potentially many months.
So what does that supportive care look like?
A cornerstone is immediate and meticulous supportive care. First, environment, creating a quiet, dark, and safe environment. You want to minimize external stimuli, noises, bright lights, sudden movements that can trigger those awful spasms.
So padded stalls?
Definitely padded stalls, dim lighting, maybe even cotton plugs in their ears. Then wound management is crucial. Even if the original wound looks healed, you need to thoroughly clean and debride it, open it up if necessary, to eliminate any remaining source of the bacteria that might still be producing toxin.
Makes sense. Get rid of the factory.
Exactly. And then nutritional and fluid support are paramount, especially if the horse has difficulty swallowing, which they often do. So maybe feeding tubes, IV fluids, and just basic nursing care, soft bedding, padded protection to help prevent them from injuring themselves during spasms.
Okay. What about medications? I've definitely heard about something called tetanus antitoxin.
Yes, tetanus antitoxin, or TT. It's an antibody solution. How it works is it neutralizes circulating unbound tetanus toxin in the horse's bloodstream, toxin that hasn't reached the nerves yet.
So it mops up the free-floating stuff?
Precisely. That's why it's vital to administer it early, as soon as possible, to prevent further toxin binding. However, and this is a really key point, it cannot neutralize toxin that has already bound to nerve endings.
So it can't undo the damage already done?
Correct. That's where the body's slow regenerative process, the supportive care, comes in.
Okay. And antibiotics? Are they a part of the treatment plan?
Absolutely. Antibiotics are essential. Their job is to eliminate the Clostridium tetani bacteria at the infection site, thereby stopping any further toxin production, killing the factory, as you said.
What kind?
Penicillin G is commonly used. It's effective. But metronidazole is often considered a safer and potentially more effective alternative in this specific case. Less risk of certain side effects. Then, for the painful and debilitating spasms, veterinarians use strong muscle relaxants and sedatives. Things like erythromycin, maybe diazepam, phenobarbital medications to help calm the horse's entire nervous system and reduce the severity of those spasms.
That pain relief?
Yes, definitely.
Yeah.
Non-steroidal anti-inflammatory drugs,
Yeah.
NSAIDs, things like phenylbutazone, Biodare, or flunixin-meglumin, Danamine, used to manage the pain and inflammation associated with the constant muscle tension, though their use requires careful monitoring because they can have side effects like gastrointestinal ulcers, especially with long-term use.
Right. It's a balancing act.
Always,
Yep.
especially in such a critical case.
Okay. So considering how truly nasty this disease sounds, how difficult and intensive the treatment is, and the poor prognosis, does that mean prevention isn't just important, but it's absolutely critical for tetanus, like the #1 thing?
It's precisely that, hands down. Prevention is the most effective strategy against equine tetanus, no question. Given the high mortality rate and the significant challenges, the cost, the suffering involved in treatment once clinical signs are established,
Yeah.
prevention is everything. And it's really a multi-pronged approach. Robust vaccination protocols combined with meticulous wound care, both are essential.
Let's talk vaccination first. How effective is the vaccine?
Tetanus toxoid, that's the vaccine, is recognized globally as a core vaccine for all horses, like rabies and West Nile in many areas.
Core, meaning every horse should get it.
Every horse, yes. It's highly efficacious. It induces strong, long-lasting protection. It's one of our best vaccines in equine medicine. For adult horses that haven't been vaccinated before or their history is unknown, a primary series of 2 doses is recommended, usually given about 4 to 6 weeks apart. And for foals, depending on whether their mother was vaccinated.
The colostrum factor again?
Exactly. Depending on that passive immunity from mom, a 3-dose series, starting usually around 3 to 6 months of age, is generally advised by the AAEP guidelines.
Okay, so initial series for foals and unvaccinated adults. Then what? Annual boosters.
That's right. Annual boosters are key to maintaining that high level of immunity throughout the horse's life. We also strategically vaccinate pregnant mares, usually 4 to 6 weeks before their due date.
Why then specifically?
That timing maximizes the antibody concentration in her colostrum, that vital first milk, which provides crucial passive immunity to her foal during its most vulnerable early weeks before its own immune system kicks in properly. Protects the foal right from the start.
Sure.
Yeah. And it also protects the mare herself during the foaling process, which can sometimes involve, minor tissue tears or complications. It's also really important to revaccinate horses that sustain a significant wound or undergo surgery, like castration, especially if it's been 6 months or more since their last tetanus booster, just to be safe.
Give them a top-up just in case.
Exactly, a timely booster in those situations.
So vaccination is clearly paramount, absolutely essential. Beyond that, what else can horse owners do day to day to protect their animals?
Well, beyond vaccination, diligent wound care is crucial. We keep coming back to that. Remember, any break in the skin, no matter how minor it seems, can potentially serve as an entry point for those hardy spores.
So every little scrape matters.
Treat it like it does. Prompt and thorough cleaning of all wounds with an appropriate antiseptic solution is key. Carefully removing any foreign debris, dirt, splinters, whatever, and then monitoring that wound closely for signs of infection, swelling, heat, discharge, and just general awareness of the environmental risks. Knowing that Clostridium tetani spores are common in soil, especially soil contaminated with manure, which is, let's face it, most horse environments.
Right.
So maintaining hygienic living conditions as much as possible in stalls and pastures, good manure management, it all helps reduce the overall spore load.
Okay. This has been a lot to take in, a really thorough look at this disease. So let's circle back to prognosis. For a horse that is diagnosed with tetanus, what does the future actually hold? Is recovery common? You mentioned the high mortality.
Yeah, the prognosis is generally guarded to poor. We have to be honest about that. With those high mortality rates we mentioned earlier, typically ranging somewhere between 25% on the very optimistic side, up to 80% in severe or untreated cases. And several factors significantly influence the likelihood of survival. Well, age plays a role. Very young animals, particularly foals under maybe 5 years old, and especially neonates, often face a poor prognosis. Their systems are just less robust. Vaccination status is a huge factor. A history of being unvaccinated or inadequately vaccinated is a strong negative indicator. Vaccinated horses, if they do somehow get it, tend to have milder cases.
That makes sense.
Also, the speed of onset and severity of the clinical signs, a really rapid progression to severe signs, especially difficulty breathing, inability to stand, recumbency, or seizures, that indicates a poor prognosis. The toxin is overwhelming the system quickly. There's a critical point here. The combination of difficulty swallowing, difficulty breathing, and recumbency is seen as a particularly strong indicator of a poor outcome, a really grave sign.
Okay.
And of course, any delays in starting that intensive treatment we talked about also significantly worsen the prognosis. Time is absolutely critical.
Right. If a horse does manage to survive this formidable disease, beat the odds, what's that recovery process like? It sounds like an incredibly challenging road back.
It truly is. It's long and slow. If a horse survives beyond the first week or so, the likelihood of recovery does increase. That's often a critical period. However, the recovery period is almost always prolonged, typically lasting from, say, 2 to 6 weeks, just for initial significant improvement. But it can easily extend to several months, maybe even 2 to 4 months for a full recovery, as those new nerve terminals slowly sprout and reconnect.
Months of recovery.
Months of careful nursing and gradual rehabilitation, yes. And while some horses do make a complete recovery and return to their previous function, the severe muscle spasms they endured can unfortunately lead to musculoskeletal injuries. We mentioned bone fractures, but also muscle tearing, tendon issues. These might result in long-term complications or require extensive physiotherapy.
Yeah.
It also raises an important, maybe less studied question about potential subtle or even overt long-term neurological impacts. Does everything fully return to normal? We're not always sure. And what's really crucial to remember for survivors is this. Horses who recover from a natural tetanus infection typically do not develop sufficient natural immunity to protect them in the future.
Really? Surviving it doesn't make them immune?
Generally not reliably, no. The amount of toxin needed to cause severe disease is actually less than the amount needed to stimulate a strong protective immune response. So, continued, regular preventative vaccination following the standard schedule is absolutely essential for these recovered horses for the rest of their lives.
Wow, that's a vital point. So, okay, wrapping this up, what does this all mean for you, the listener, the learner, the horse owner, maybe just the curious mind? We've taken a really deep dive into equine tetanus today,
Hmm.
from those ubiquitous, incredibly hardy Clostridium tetani spores in the dirt, to the devastating irreversible binding of that neurotoxin tetanospasmin, and the heroic, intensive, and often heartbreaking efforts involved in treating affected horses.
Yeah, the takeaway I think is pretty clear. While tetanus is undoubtedly a formidable, often fatal disease, our understanding of how it works, its pathophysiology, its clinical presentation, and especially our tools for prevention give us a powerful defense. The story of equine tetanus is really a testament, isn't it, to the fact that sometimes the simplest, most proactive measures, like meticulous wound care for every little scrape and just staying on top of regular vaccinations, those are the most profound and impactful things we can do.
It absolutely highlights the critical importance of being proactive rather than reactive in animal health, thinking ahead. So maybe something for you to consider. Knowing now how subtle those early signs can be, how widespread the bacteria is, and how quickly tetanus can escalate, what practices, maybe in your own environment or perhaps with animals you know, might you reevaluate, just to ensure robust preventative measures are solidly in place. Definitely some food for thought until our next deep dive.